Welcome, everyone. Thank you so much for joining us tonight for this webinar. Really glad to see all of you here. I see some familiar faces. I know a lot of you come to a lot of our webinars, which is awesome, but I see some new names and faces too. So in case you don't know, my name is Samantha Van Buren, and I am the Associate Director of our health programs here at Special Olympics New York. And as some of you may know, part of our work focuses on providing health education and wellness opportunities for our athletes, families, and community members. So we're really excited to be able to, host conversations like this one. And so tonight's webinar, it's going to be part of those, ongoing efforts with our health education to support health and well-being in our community. Um, I know that topics like this, sexual health and relationships, they're really important for overall health, but they're not always talked about so openly. So, the goal is to provide a respectful educational space where people can learn, ask questions, and gain some helpful information. So, yeah, before we get started, I just want to thank you all for taking time this evening to join us and being open to learn more about an important topic. And we are joined tonight by our guest speaker, Liz Schmidt. She is an associate professor and director of research at Lincoln Memorial University. Um, Her work focuses on health education and research. And like us, she's passionate about helping other people understand topics related to health, relationships, and overall wellness. So tonight she'll share with us some information about sexual health, healthy relationships, and an opportunity to learn more through paid research participation. Um, and then just a few like etiquette things before we get started. You guys are always really good with this stuff. But please just stay muted while Liz is presenting. If you have a question while she's talking, you can put it in the chat and we'll make sure that it gets addressed by the end of the night. Obviously, if Liz like asks us questions or starts a discussion, you can answer on your mic or you can just put it in the chat. It's up to you. But yeah, I think that's pretty much it before we get started. So thank you all again for being here, and thank you, Liz, so much for being here and presenting for us tonight. So yeah, I guess, Liz, I'll just turn it over to you.
Fabulous. Are you able to see my full PowerPoint slide? Okay, wonderful. Well, thank you so much for that introduction, and thank you so much for having me with you all tonight and for attending. Like Samantha said, my name is Liz Schmidt. I am an occupational therapist, and I actually got into this work because my cousin, who had an intellectual disability, ended up being diagnosed with AIDS in his 30s. And it really opened my eyes to the importance of learning more about sexual and relationship health education for folks with all sorts of disabilities. And, making sure that folks aren't left out of what is being received in school settings and that that information is really accessible to them. And so I sort of came into this work from that sort of personal stance. And as I've gotten into this work, I've learned more and more areas where folks have expressed a desire to learn more and have more interests and needs. And so it's kind of evolved over time, but I'm really excited to share with you all a little bit today about what I have learned and sort of the importance of sexual and relational health education, and some of the sort of accessibility tips and resources that I have found over the years, as well as share a little bit about that research study that Samantha had mentioned. So, why, you might feel like sexual and relational health isn't necessarily important for you or for someone else in your life for various reasons, but the research does support sexual and relational health for individuals with disabilities in terms of promoting safety. And when I talk about safety, we'll talk a little bit about both psychological safety and physical safety, happiness, understanding oneself and their identity, overall health, and then, of course, hygiene. So these are kind of the five main topics that I'll start off by talking about today. So to kind of start us off, I like to be a little bit more engaged and full transparency. I am 9 months pregnant, and so I'm very out of breath if I talk too long. So I'd love to hear from all of you throughout. Can anybody share sort of what they feel like makes a relationship seem safe, or how you feel when you know it feels happy? And you can put this in the chat or unmute at this time to share.
When you're able to share information with that person and they keep it to themselves.
Sure. Like privacy and respect. Absolutely. Thank you, Carol. Anyone else have anything they'd like to add to that?
I would just say, feeling safe and being able to tell them like how you really feel and not, being afraid of how they might react and just knowing that,
Mhm.
regardless of your feelings, you're still safe with that person.
That's a really good point. Yeah. Because everyone has the right to safe relationships. And that's the same for friendships, dating, love, intimacy. And like Samantha was saying, with those rights really come the right to feel safe to say yes or no, to change your mind, and to still be treated respectfully. Um, and a lot of what sexual and relational health education covers is how to recognize these signs of, a psychologically safe relationship. And that can be, again, within friendships or intimate partnerships. Um, so a lot of that kind of education will talk about consent and what it looks like to get consent from someone else and also to give consent to someone else. And sort of what that safe and unsafe touch looks like. And just to kind of provide some of that background, when we're talking about consent, I'm talking about both people agreeing and understanding what they're agreeing to, and you're agreeing without pressure. So if there is somebody who's putting pressure on you to commit to something or to agree to something, then that's not true consent, even if you say yes, because that component of that pressure is there. Um, it's also, like I said, a lot of sexual and relational health education will help provide the difference between healthy and unhealthy relationships. And a lot of this goes along with what Carol was saying, right? Having respectful interactions with someone else, listening to one another and hearing them, being able to sort of share decision making. Whereas unhealthy relationships might look like someone who is trying to control a situation or isolate you in any way, or kind of manipulate or pressure you into certain things, or even exploit you by asking for money or any of those other components. Those can all be examples of unhealthy relationships. And again, this goes for friendships too. Um, the other kind of component of psychological safety that I think is really important that most health and relationship education programs are starting to cover is digital and online safety. So many of our relationships now begin or continue using the internet in some capacity. And so having that education to help recognize when maybe somebody isn't who they say they are. And understanding risks associated with sharing any information or photos of yourself online or with someone that you're not seeing in person can really help to make sure that you're making healthy decisions for yourself. Um, there's a lot of things you can do, like block someone or report them online, but we often have to learn those processes. And so, more and more, we're seeing sexual and relational health education curriculum include these topics and components. which I think is a really important part. The other thing that I think is really important when we think about psychological safety is sort of supporting our own self-determination. So if we are never explicitly taught about relationships, we may just avoid dating altogether, or maybe be hesitant to make a new friend or join a new friend group, sort of out of fear and sometimes that overprotection. But with education, you feel more prepared. You feel like you can make informed decisions. You feel like you have more independence and autonomy to have these relationships that can really bring a lot of joy. The other important thing to kind of think about in relation to safety, psychological safety, is the fact that unfortunately a lot of people with disabilities do experience abuse at some point in their life. And so, and this is researchers believe that this is probably still underreported, meaning that not everyone always even recognizes or is able to report the abuse that has occurred. And so it's really important that we have this education about what are these healthy relationships so that we can recognize signs that something may be unhealthy or unsafe, and we would know who to talk to in those situations and can seek help earlier. I think we often assume that this psychological safety is just something that we all innately have, but really it's a skill that we need to develop and we need to practice. And so a lot of sexual and relational health education courses now will include opportunities for us to practice and kind of role play different scenarios and how we might respond that can really help us to sort of build the tools to know what to do if we were ever put in a situation like this, or if you see one of your friends or loved one in a situation like this. In addition to psychological safety, there are major benefits to physical safety with sexual and relational health education. So there is a lot of research now showing that these comprehensive programs that cover a lot of different topics, and we'll talk about what those are in particular in a few slides, can really help delay initiation of sexual intercourse. So sometimes there's this myth or belief that if people learn about sex, that they are going to engage in sex or risky sexual behaviors. And what we actually see is the opposite. As people learn more about sexual and relational health education, they're more likely to wait and to say no or wait until they're older to engage in any sexual intercourse. We also see that when people do engage in sexual intercourse, it's typically safer, meaning they're using condoms or contraception to help prevent sexually transmitted infections and any unplanned pregnancies. I sort of mentioned this earlier, but one of the big kind of perks to learning about sexual and relational health education is just that it can really help us build those positive, healthy relationships. And that has a really important contribution to our happiness. So all of us, all humans are wired for connection, right? We often are seeking out friendships or intimate partnerships as core components of our human experience. And everybody has similar, desires for that connection to some capacity. Now, of course, that might look different. Some people may prefer more physical touch. Other people may prefer more intellectual conversations, everyone has something different in terms of how they describe that connection and what makes them feel like they belong within a relationship. But regardless, we're all looking for those components. And so, again, by providing that education on what healthy relationships entail and what they look like, and helping to develop the skills so that people can communicate and regulate their emotions and resolve conflicts or disagreements within these relationships often contribute to overall improved happiness. We see that folks who are able to establish those relationships have improved overall perceptions of their social experiences. and have higher confidence and self-esteem. We also see overall reduced social isolation or feelings of loneliness. Um, let's see. Another important component is understanding oneself. So, knowing what you like and dislike so that you can provide informed consent within a relationship. And of course, this can be, knowing what you like or dislike so that you can communicate, like physical touch or sexual preferences with partners. Or it could be something like knowing what you like and dislike in terms of what hobbies you want to engage with in a friendship, whether you want to go see a certain movie, or whether that's really not something that's of interest to you. So, trying to really understand yourself better, knowing your preferences, knowing what makes you feel uncomfortable, but also knowing, what and who you're attracted to, and what you're looking for in intimate partnerships or relationships, if that is something important to you. So we know a lot of folks with all sorts of disabilities are also LGBTQIA. And so when I say that, that acronym stands for lesbian, gay, bisexual, transgender, queer, intersex, asexual, or another gender or sexual orientation minority. And so just better understanding yourself and your own identity through learning about others. Um, Genders and sexual orientations can be really helpful through a sexual and relational health education curriculum. And even if you feel really confident knowing who you are, it might help you better understand other people that you may come into contact with. So, other friends that you may have who may be questioning their identities, or who maybe are LGBTQIA. Sexual and relational health also should include components that help support your overall health. Um, and this includes building healthcare navigation skills. So, being able to feel confident as you schedule appointments, ask your providers questions, request sexually transmitted infection testing if you would like, obtain contraception if you would like, and just understanding your overall prescriptions or medications that you may be taking. And with that, it really helps to increase your overall independence navigating the healthcare system, and it can help reduce preventable health complications. So, all of that can have really positive impacts on your overall health for the long term. And then the last one I want to talk about that I think is an important perk is hygiene. So within sexual and relational health education, we often will also talk about anatomy and hygiene. So this can include things like proper physical hygiene, including your genitals and menstrual hygiene. This can also include um, like hygiene before and after sexual activity or knowing when to seek out medical care. And what we have found is that folks who have overall better physical hygiene also see increases or better social success, overall independence, and reduced shame around your body, which can help increase your overall happiness and well-being. So this is another really important component. And again, without really getting this education, we might use the incorrect products or not understand how infections occur. We might miss signs of irritation or infection. And all of that can contribute to things like very, common health conditions like urinary tract infections, yeast infections, or skin irritation that could go on much longer than they need to. Um, it's also important to learn in general about puberty, menstruation, and kind of how our bodies change so that we know what is considered normal and we can recognize if something is changing in our body that we should maybe talk to a doctor about. So this kind of goes alongside with that health navigation component. And like I said, it can really help improve our overall confidence in social situations and reduce social stigma so that we can have overall closer, healthy relationships. All right, I've been chatting for a while now, so let's um, let's kind of go through this little myth or fact activity. And I'd love to hear from folks. If you don't feel comfortable saying it out aloud, you can put your answer in the chat, or if you would like to share your response aloud, please feel free to unmute. But our first one is people with intellectual or developmental disabilities do not need health and relationship education. Do we think this is a myth, meaning it's not true, or a fact, meaning it's true?
A myth?
A myth. Yes, exactly. So, I'm sorry, I couldn't see who had said that, but you're exactly right. This is a myth. Everyone has bodies and, like we said, has relationships and is interested in connections, and everybody deserves accurate information. And so, what we often see in the research is that folks with disabilities often receive less information than their peers related to these topics. And we really should be providing all of that information. The access is necessary for all of the reasons we just chatted about. Thank you so much. The second one, teaching health and relationship education increases risky behavior. Do we think this is a myth, meaning it is not true, or do we think it is a fact, meaning it's true? Oh, I'm missing the chat, aren't I? I'm sorry. Great. Okay, yes, I see people saying myth for this one as well. And you are exactly right. This is also a myth. So, like we talked about earlier, comprehensive sexual and relational health education is actually associated with better, safer outcomes. So, what we find is that the more people know about consent and boundaries, the safer they are. And avoiding education does not prevent curiosity. All right, our third one, health and relationship education is only about sex. Do we think this is a myth, meaning not true, or a fact, meaning true? All right, I see people putting in the chat, it's a myth. You are right. Great job, everybody. This is also a myth. Health and relationship education should be comprehensive and include really important topics like friendships, communication skills, consent, understanding your body, online safety, identity, and self-advocacy. All right, number 4, it is possible to teach health and relationship education in ways that are accessible and respectful for people with intellectual and developmental disabilities. What do we think? Myth, not true, or fact, true? Yeah, great. All right. And I thought that maybe I would end up tricking you on accident here with so many myths in a row, but you're right. This is a fact. There are lots of different ways that sexual and relational health education is taught now that makes the information more accessible, including using different visuals, plain language, like I mentioned earlier, role playing and things like that. Another important component about sexual and relational health education is teaching those self-advocacy skills in sort of that like supported decision-making processes. So, for example, you might work with your healthcare provider and discuss kind of pros and cons of a certain medication and how it may impact you. And only you get to, I mean, you're the person who understands yourself the most. You get to bring that information to the doctor and help make the best decision for yourself with both of your sort of expertise. All right, number 5, parents, caregivers, or support staff should make all relationship decisions for adults with disabilities. Do we think this is a myth, meaning not true, or a fact? Great. I see lots of myths coming in, and I love Samantha's, no, it's a myth. You're exactly right. This is definitely a myth. Um, all adults have rights, right? And safety and support matter. So there is an important distinction between kind of offering support and still ensuring autonomy, meaning we get to make our own decisions for ourselves. All right, last one. Not receiving education can increase vulnerability to abuse. Do we think this is a myth, meaning not true, or a fact, meaning true? Yes, you all are correct. This is a fact as well. It's really important that we know our body parts and know what consent means, that we know how to say no and how to report concerns. And again, that all of that information is not just intuitive, right? We don't know that without learning it in some kind of sexual and relational health education course. So now that we've shared a little bit about kind of some of the perks and importance to cover different topics related to health and relationship education, I'm hoping to hear from you all. What, when you hear the words health and relationship education, what comes to mind for each of you? And again, you can unmute or put it in the chat, whatever you prefer. Okay, Lene said safety. Laura, prevention, excellent. Communication, how to recognize a healthy versus unhealthy relationship. Yes, awareness, excellent. Yeah, these are all really good things coming to mind and definitely important components of good comprehensive sexual and relational health education. So, before we talk about what that should look like, I want to tell you a little bit about some of my dissertation research. So I did a big research study and I talked with folks with intellectual and developmental disabilities. I talked to parents and caregivers. I talked to healthcare providers and I talked to educators. And I was asking them about when they provided or received any sexual and relational health education. And what I ended up finding was really interesting and kind of pretty alarming to me that most people were reporting that they really only received sexual and relational health education through naturally occurring conversations. And what I mean by that is that they had started puberty. So naturally, they had to talk to somebody about the physical changes going on in their body or how to, engage in menstrual hygiene management. And so it was really very puberty driven. Or the individual themselves, as growing up as a child or whatever, had to ask a caregiver, educator, or healthcare provider for specific information. It was not readily provided to them. They really had to kind of, um, I want to say, like, be pretty brave, right? And ask what can sometimes be uncomfortable questions to try to get the information that they wanted about sexual and relational health. And then the last way that I came up was through safety concerns. And this was if someone else had a concern about an individual with a disability, either maybe not having a good understanding of boundaries, and they were worried that they might accidentally or intentionally harm someone else, or the opposite way, that maybe they were not recognizing signs of unhealthy relationships and they were worried that they might experience abuse or be taken advantage of. And so then somebody was going to provide conversations. But it was really through these kind of three main channels that any information was provided. And what that often meant was that they didn't get good comprehensive information. It was usually very specific to whatever the reason was that was initiating the conversation. So, for example, for the folks who were puberty driven, it might be more anatomy and puberty based. For the safety concerns, it might be more boundaries and, abuse, safety, those types of concepts. So, if anybody's comfortable sharing, and please do not feel pressured to by any means, but if you could share a little bit about how you learned about health and relationships growing up, and maybe what's one thing you wish people talked more about.
Um, I say that I've been married for 13 years,
That's
and my
wonderful.
wife and I have been in the same school, special ed. Um, we try to have love, but it's not the easiest thing for us, but we try our best. But it's not always sex, it's always we work together, we support each other, and support our health, our first, be sure we're okay, and just joy watching our sisters and brothers have kids, like if it was ours, but there's so much in our lives, and we support each other.
That's great. 13 years is a long time. Congratulations.
Thank you.
And I love what you talked about too, in terms of how intimacy in our relationships can look really different. And that's all incredibly valuable. Thank you for sharing, Paul. Anybody else?
I would say I was mostly taught about these things from the school nurse
Okay.
and like my health teacher growing up. And in high school, we did talk about like, healthy versus unhealthy relationships and things like that. But I wish that was talked about like a little bit sooner, like maybe in like middle school or like, later elementary school. Because, even just like friendships and things like that, I wish that was something that was more talked about early on.
Yeah, I'm with you. Kevin, yes, please.
Um, my parents always taught me that if you love each other, it's not about having sex, it's about still love each other, going out, doing things, and go to a movie, go to dinner. Everything's not about sex. It's not.
Mhm. Yeah, absolutely. There's so many ways to show our intimacy and our connection with our partner.
Yep.
That's great. Thank you for sharing.
Yeah.
Excellent. Yeah, I think I had a similar experience to Samantha. And Kevin, really, where I had sort of a mix of I learned a little bit at school, and it was mostly around puberty and preventing sexually transmitted infections. So more of that like safety puberty stance. But then also similar to you, Kevin, my parents did talk a lot about, what healthy relationships look like and how there are so many different ways to express your intimacy. And that was sort of what my education experience looked like.
Mm.
Um, and, really, sexual and relational health education has evolved quite a bit. And I think will continue to change as we learn more about what people want and what's important and, what seems to have the best outcomes. Um, but what sexual and relational health education should look like, according to the evidence and the research, is that it should be focused on helping to provide learners with the knowledge, skills, and attitudes to, enjoy your sexuality physically and emotionally. And like we said, that can be through all sorts of different ways of expressing your intimacy. It should equip people to have the right information about their rights, and it should be focused on developing life skills like communication and how to negotiate or resolve conflict and make decisions and assert what we want in a relationship or from a healthcare provider, for example. And sexual and relational health education really should be, again, rights-based, comprehensive, meaning it covers a lot of topics, holistic, and inclusive, and culturally responsive. So ultimately, from lots and lots of research articles that I've read, most comprehensive relational and sexual health education includes the following topics. So it includes gender, so exploring the difference between gender and sex, exploring gender roles and attributes, understanding perceptions of masculinity and femininity, and how familial and societal norms or values may influence that. as well as how gender bias, stereotypes, and inequality might influence that. It should also include anatomy, reproduction, puberty, menopause, how to use condoms safely or other forms of contraception should you decide you want to engage in sexual intercourse, stigma and sexual problems, like erectile dysfunction or some of those types of specific conditions, pregnancy options and information, HIV and other sexually transmitted infections, including how you would spread these specific infections, what the symptoms look like, how you could prevent them, how you can treat them, and who to talk to if you need support. Sexual rights and sexual citizenship includes knowledge of human rights and policies, laws and structures that relate to sexuality, understanding sexuality and cultural diversity, and diversity of sexual identities, including advocacy, choice, and protection, as well as negotiation skills and consent. So being able to provide consent and recognize when you are receiving or not receiving consent. Pleasure includes a positive approach to sexuality. So this is focusing on both consensual but enjoyable sex for those who do decide to engage in certain sexual behaviors. Violence explores various types of violence towards people and how they manifest, including gender-based violence, non-consensual sex, and understanding what is unacceptable, the rights and laws, and how to seek support or help. And then diversity is referring to recognizing and understanding the range of diversity in our lives and how that relates to our sexuality. And lastly, the relationships component. And this is sort of interwoven in most topics I have found. And it's referring to the different types of relationships we have, our family, friends, intimate partnerships, romantic relationships, sexual relationships, and sort of how we navigate those. And so all of those components should be included in a truly comprehensive sexual and relational health education program. Now, obviously, in one conversation today, it's not enough time to dive into all of those specifics and provide lots of education for each of those areas. But there are a lot of really cool resources. And I believe, Samantha, are you able to send out the PDF of these slides afterwards?
Yeah, absolutely.
Okay, fabulous. So that way, if you want to check out any of these resources, you can. There's so many different things out there now that can help to learn about these different topics. I think that some of my favorite are the YouTube Amaze organization and then the Watch Wellcast. They have some really fun educational videos that I think help break down topics that are pretty complicated in a fun and easy way to understand. And so I really enjoy those. But there's lots of different options here. If you prefer to like read a book or a story, there's different books and articles here as well. These are all my references from earlier. And I know I want to leave enough time for any questions and discussion. So I'll go through this pretty quickly. But I wanted to tell you all about an opportunity to participate in a research study. This study is called Preliminary Feasibility, Acceptability, and Efficacy of the Elevatus Curriculum. On the study team is myself, an occupational therapist, as well as Lauren Wangard, who is an occupational therapist, Catherine McLaughlin, who is the founder and creator of the Elevatus Curriculum, which is a comprehensive sexual and relational health education program for folks with disabilities. And Catherine is a disabled advocate herself, who has worked with a lot of disabled folks to create the Elevatus Curriculum. Jess Bauzade Garcia is an autistic occupational therapist and researcher working on this project. And then Emily Carey is a licensed psychologist on the project. So lots of different kind of backgrounds and areas of expertise. This project is really focused on kind of laying the groundwork for future research. So we're working to build an inclusive research team, test the Elevatus program both online and virtual formats and in person in Knoxville, Tennessee and Columbus, Ohio. Um, Learning from our participants what they like about the program and what they don't like, as well as what they like and don't like about the research study process. And then all of that information will be used to kind of help set up a larger study in the future. And so we are actually looking for 20 to 32 autistic adolescents and young adults. So we're looking specifically for folks ages 14 to 22 years right now. This could change in the future though. So if you are younger or older than that age range and you think you're interested, I would still recommend you reach out to me via email because we're doing a lot of different research projects in this area. And I can kind of keep track of folks' emails to reach out to you if a different opportunity arises in the future. And this is just a little like email blurb that'll be in the PDF for you all. So what would it look like if you choose to participate? First, we would schedule a time to meet with you and to get your consent. If you are under 18 or you are not your own legal guardian, then we will still go through the information about the study and get your assent or permission to participate. And then we'll get your permission from your legal authorized representative. Then you can choose your preferred format. So whether you would be participating virtually or if you live in Knoxville or Columbus and wanted to participate in person. And then we would also be grouping you by age so that if you're 22, you're not necessarily grouped with a 14-year-old, you're with other individuals who are closer to your age. And then you would go through some pre-test measures. And what that looks like is getting on a Microsoft Teams call, sort of similar to this Zoom call, and going through sort of an interview process where you help describe what your goals are for participating in a sexual and relational health education program, completing some surveys through an electronic survey system called REDCap. It's sort of like Qualtrics or SurveyMonkey, which I feel like some people might be more familiar with. And then you would participate in the Elevatus curriculum. And that meets for 11 weeks, 2 times per week for an hour and a half. So it's a pretty intensive program, but that's how it works to make sure that it kind of covers all of those areas that we talked about that were important for comprehensive evidence-based sexual and relational health education. And then after you're done participating, you would have the same surveys and interview process, as well as a couple of really quick surveys to get your feedback on what you thought about the intervention and about the study itself. You would receive a $25 gift card after completing the pre-test measures and a $25 gift card after completing the post-test measures. Although there's no compensation for participating in the Elevatus curriculum, it is a free sexual and relational health education program provided by a trained facilitator. So those pre-test measures include just kind of sort of like a test almost in a way, but on your sexual health knowledge. And then a couple of questions about your overall feelings of belongingness within social relationships, and then individualized goals. We also are, like I said, looking at kind of what works and doesn't work about the intervention itself and the study. So we'll look at whether we can recruit enough folks, if everyone is completing the program, or maybe it's happening too much and they can't come all the time. And how well our educators are following the Elevatus scripts and curriculum. And then just your overall opinion on them. All right, so that is a little bit about that study. And like I said, even if you're not in the right age range or something like that, if it's something that you're interested in, please reach out to me. And I would be happy to let you know about any other opportunities we have in the future. But for now, I think we have the next 15 minutes or so for any questions or discussion or conversation that anybody wants to engage in. Thank you, Kevin.
When do you think is the best time to begin to start talking to a young adult on the spectrum about, sex and sexual activity?
I am a huge proponent of as soon as possible. So a lot of the research that I've read really supports kind of having conversations more regularly, early, and often. So, sort of starting those, wherever you're at now. And it might be sort of small conversations. One of the interesting things that came up in my research was that a lot of people talked about if they were going to have these conversations, they started like in the car where you don't have to necessarily look at the other person and it's maybe a little bit less awkward, more comfortable. Or a lot of professionals talked about also kind of using humor or like, if somebody is watching a new show or reading a new book, talking about components that are coming up within there so that you can still sort of use those natural conversations, but maybe more intentionally um, start laying the groundwork for any other questions and kind of making it known that they can come to you with any questions that they have and sort of just creating that open dialogue for future conversations.
Yeah, 80 degrees. I do not know.
That was a great question, though.
I asked it. I am very much a proponent of teaching your kid as young as possible, but I think I'm usually like the outlier. My daughter, being diagnosed with autism, she also had pre-coast puberty. So we started with her menstruation at 7.5. And so those were questions, and the whole topic, right, kind of blew our minds. But it was like I'm a proponent of speaking to kids. Like the fact that I was a single mother and I was a working mother, the minute she stepped out of my house, I wanted her to understand what touches look like, what improper touches look like. So we had those talks very early on, but I realized that the parents who are in my same circle are usually like, no, I don't want to talk about it, or no. And I was like, it wasn't a question of whether I wanted to talk about it or not. It had to happen because she was dealing with it at such a young age. And I find even now, my daughter's 23 years old, even in terms of like now her being in this world of neurodivergence, right? Like there are, young men who like her, and I that parent that wants her to go on dates and explore all of these other things, but I realize that other parents are not as open to that. And so sometimes, like, I find it so difficult to figure out how to invite her to socialize or how to get her into environments where she can socialize and experience dating, because not many parents are on the same wavelength when it comes to that.
Yeah. Yeah, I think it's really challenging because you're right. I think a lot of folks are very nervous that by having the conversations, it will result in an outcome that they're not looking for. And that's why I think some of this evidence is just so powerful to know that the more we actually do talk about it, the better the outcomes are, the safer people are, the happier they are, the healthier relationships they're in. Um, and I think it sounds like you're really doing all of the right things in terms of what all the research supports and everything of like encouraging her to explore her interests and engage in these social relationships and all of that and having those conversations at young ages. But I can definitely agree that it is challenging because I do think that your approach is more of the minority in terms of many other families that I've worked with, where it takes a lot more to encourage that comfort level to have those conversations. And I think a lot of that also stems from times are changing and a lot of us didn't have them with our own parents either. And so it's like, well, I don't even know, I don't have something to go off of in terms of how to have these conversations. But some of the resources on that slide too are great for parents and caregivers as well to have, something to look at, or for the folks who maybe are less comfortable, having like a video or a book that you read together can sometimes help break that ice a little bit. And then again, have some good, like, okay, now we can talk about what we just learned, as opposed to trying to like come in without, a plan or feeling very comfortable about a certain topic, if that makes sense.
I just got something to say.
Yeah,
I
please.
go, well, because they say back when you were in the meeting, another thing you say is about when I went to school, I never, we never got taught in school from
Mhm.
nurses or anyone about sex or anything because I was in special ed. Back in my times, they didn't have that stuff.
Yeah.
You just stayed in one class and you teachers just teached you in everything you did
Hmm.
stuff. And I always learned from my parents, never have someone force you to do something that you don't want to do. You,
Absolutely.
you do what you want, and it's not always about having friends or having a girlfriend and just stay friends with them to have sex with them. If you don't want to do, you don't do it. You say no
Mhm.
to them. That's all.
Yeah, Kevin, I think you bring up a really good point. And I think unfortunately there are still a lot of
Yeah.
schools and states that don't have any kind of sexual or relationship health education,
No.
especially in special education settings still.
Yeah.
So we still have a ways to go, I think, in terms of advocating for the importance of providing that information in multiple places, because it sounds like your parents had great conversations with you, but not everybody's parents do have those. So it can be really challenging then, and folks just miss out on all that really important information.
Yeah. And I always just tell my friends that if you don't like what I do, I told them, and I can't do what I want to do, and I said, then you're not my friend. I told them. That's what I used to tell my friends. I say, I'm not going to do what you want me to do. I say, I'm going to do what I want to do. So if you really was my friend, you wouldn't force me or talk me into doing something.
Yeah.
I say, then if you don't like what I'm doing, then I say, then I guess we're not friends anymore. I tell
Mhm.
them. That's the way I put it to them. I do.
And that's a skill, Kevin, to be able to assert what you want in a relationship. And so that's it's awesome to hear that that's something that it sounds like you can do really well and easily, but a lot of other people need time to practice that and learn that. And it can be really hard to stand up for what you want in a friendship or a relationship.
Yep, and stuff.
I have another question for you, and this may be a little bit personal, but you mentioned your cousin
Yeah.
having a diagnosis of AIDS, HIV. Like, what does the research say about the population, the neurodivergent population, and their acquiring of STDs and just
Yeah.
different diseases as, HIV, AIDS, because
Mhm.
of the lack of awareness of the sexual habits, right?
Yeah.
Healthy
Yeah.
habits.
So, fortunately, the research does not show increased risk of STIs or HIV/AIDS for folks with disabilities. That originally I thought I would focus my dissertation work specifically for folks with intellectual disability and HIV/AIDS. And fortunately, I found very quickly that the research shows that it's actually a very small percentage of folks who have both, which is a good thing, right? But I think I guess more um, like concerning thing we see is often around the sexual abuse, which of course, with increased risk of sexual abuse, that in itself can increase risk of STIs and HIV/AIDS. But overall, like in general, we see that it doesn't appear to have like worse outcomes for folks with various disabilities. That's a good question.
Is it because it may be underreported as well, or is it just that
I do
it's not
think that
there?
I do think that that is probably a part of it, and there is research that shows a lot of folks with various disabilities are less likely to receive STI testing. They're less likely to receive pap smears and just kind of basic um, reproductive health care than other populations. And so I do think it probably is underdetected to some capacity. Yeah.
I don't want to take up all the conversation. So if anybody has questions, feel free to go. But I do like have a lot of questions just because I'm very interested in this topic.
I love it. And we can always chat more later too. My email is at the end of the slides too, and I'll put it in the chat so that we can always connect more if there's other questions that are not answered, or if you are just not comfortable asking a question in this format, that's fine too.
I just know one more thing I can say that I learned a lot too from like being in like in Special Olympics too a lot. All my 52
Ooh.
years I've been involved. Um, some of my teammates, I learned a lot from like being registered, going away, staying overnight, and a lot of my teammates were new on the team and stuff. So when they go away, we have like girls, like a co-ed team, girls mixed in and guys playing on the team. I say, don't worry about it. I say, you're not going to roommate with a girl. I say, you have to roommate with a guy. That's the Special Olympics rules. No matter if she's your girlfriend or she's who she is to you, I say, you cannot roommate with her. You have to roommate with a guy. I say that's for safety, healthy safety reasons. I go for Special Olympics. I go. I say anything you do outside of Special Olympics, that's on you. But I say anything with Special Olympics, you can not roommate with a female athlete or nothing. You can't.
Mhm.
I say not even a coach can. They have to be like a female athlete, male athlete. You have to have the same genders in the same room. You would have to. So, which I think it's a good idea
Mhm.
and stuff. No matter, I think the same way too. No matter if you're, I don't know if it's still the same, but even if you were husband and wife, you still had to not be the same. You know what I mean? You have to have like the same. You know what I mean? They wouldn't allow that. They wouldn't. But
Great.
so I told my teammates all that when they were growing up on the team playing. I say don't get yourself excited. I say because you're not going to roommate with your girlfriend. I go. He told him. So, but I learned a lot of stuff from being in Special Olympics and stuff too. I did.
That's great. It's a great resource. And I love that the Special Olympics now have these health specific programming and initiatives and people like Samantha to make these types of conversations happen.
Yep, they do. But some people don't don't get it. Some of them, know what I mean? They thinking that they still can do what they want. They do.
Hmm.
But they learn after a while because when the coach tells them they can't, then they're okay with it. They are and stuff.
Thanks, Kevin. Does anyone else have any other questions?
I can say something.
Okay.
Uh, for parents that are have special needs kids, you have your spirit up high and treat them like if they were with like their brothers and sisters are like, and they'll be fine. Just trust them. We do get married and have children. Not all of us. Some of us do have kids. We have at least five athletes have kids. They drive like we all do, and have one wife. Even some of us have our own 401k plan for retirement, believe it or not. You should treat us as normal as possible. And it all starts by playing soccer. That might help to heal the brain because the motion of action constantly stopping, going, to your brain moving that helps to heal for a lot of athletes.
Excellent. Yeah, thank you, Paul.
Like I will just say one more thing. Like Paul was saying, with your job and everything, with 401ks, my job, it took me 5 years to get it because I studied for 5 years to get it. And I've been there on my job now for 29 years. I can retire in June if I want, or December. I have 30 years, I will. And it took me too long for my to get my job. So I said, I'm not gonna go out there and do something bad to a girl or a kid or something. I work too hard for my job. And my life and freedom is more important than doing something that you did wrong you shouldn't be doing and stuff. So I'm happy. I got my freedom, I got my job, I got my pension, so I don't have to worry about it. I say it's not all about going out there doing something wrong and having fun. It's about being positive, honest, and don't do something. I figure.
That's a great outlook. And that's incredible. 29 years at your job. Congratulations.
Thank you. So I enjoy it.
Excellent.
So
You guys are talking about the 401ks a lot tonight, so I think like maybe we should have a financial health webinar
yeah,
soon.
Yes.
That would be a good idea. So I'll look into that. Um, does anybody else have any questions before we kind of wrap up? And like I said, I'll share the resources, great resources that Liz shared with us, her presentation and everything. She does have her email in the chat now if you want to take a look at that. Um, and if you want to email her if you have any other questions, or if you're interested in the study, like she said, and even as she said, even if you're not in the age group that she talked about, the 14 to 22 years old, that's okay. You can still reach out to her if you're interested, and she can let you know if another opportunity comes up and, chat with you. So, yeah, so thank you so much, Liz. That was really great, very informative. I know I learned a lot too. I'm sure that we all did. Um, so thank you so much.
Thank you so much for having me. And like I said, I'm always so excited to talk with others. So please feel free to reach out if, Melissa, I know you said this is of interest. I'd love to hear from you and anyone else who feels that way as well.
Yeah, thank you so much. And so, yeah, so I will share those resources, and we will also have the recording of this webinar on our YouTube channel probably by the end of this week, but I'll send out an email to everyone who registered with all those resources, the recording, and all of that so you can access it later. And we do have another webinar next week, actually. We normally just have one a month, but we are double dipping this month. We have a little extra. So that will be on brain health. That will be March 18th at 6 p.m. With Tracy Margram. He's one of our Strong Minds clinical directors, and he has a master's degree in mental health counseling. So I'm just going to drop that in the chat just in case anybody's like, oh, that sounds cool. It is coming up pretty soon. So the link to register for that is in the chat. But yeah, I think that's all I have. Thank you, everybody, so much
I
for
just got one more
coming.
quick thing to say,
Okay.
just to cheer everybody up with a joke. It says,
Okay.
how
Sounds
many
good.
how many feet are in the yard?
Well,
Anybody
3
knows?
feet.
oh,
3
Is it
three,
feet.
12?
2 feet.
She
No,
said
it
12.
says
It's 12 inches to a foot and then 3 feet to a yard, right?
8 feet in the yard.
Right? Okay.
No.
it depends on how many people are standing in it.
Okay.
That's a good one. Yeah, I was stumped on that one.
Yeah, yeah.
All
Very
right.
good, very good one.
Yeah,
Yeah.
you too. Thank you so much, everybody.
Welcome.
Thank you,
Thank you.
Liz. Great to see you all.
You
See you all
too.
Good
again
night.
soon. Have a good
Night.
night.
Thank
Night.
you
Thank
all.
you.
Have a good night.
Night. Thanks.